All right, so asthma. Everybody knows what asthma is? This one? Plague. Ingrown toenail is interesting because there are several ingrown toenails, and which is the beauty of SNOMED. And there's one which actually has no social life, which means they have no hierarchical relationships. And they're probably going to deduplicate that and merge them. And that happens from time to time. So if that happens, and if you see a concept that has nothing, no relationships, no ancestries, no children is okay, but no ancestors, and you think like there should be some ancestors because it's a condition clearly that should be embedded in a larger conceptual space, and it doesn't, it's fishy. I wouldn't trust it. And that's because SNOMED is also churning and improving and getting new. The way that works, it's international organizations that have national chapters. People from all over the world submit concepts into SNOMED. They bring them in first, and then they fix them. So you have, for a while, you get some not so well curated concepts, and then they get fixed at some point. So they bring the stuff in, it's dirty, they fix it. They could have fixed it before they bring it in, but they don't. That's how they work. And we don't second guess SNOMED. So you have two, and one of them has a social life and the other one doesn't. Now let's go to drugs. How does it work with drugs? We know how the condition works. There are source concepts, there are standard concepts, there are classification concepts, and you can move up and down the hierarchy. How does it work with drugs? Well, the short answer is exactly the same way. And actually, it works exactly the same way with everything. Okay? So now that you know how the conditions work, the drugs should be fairly easy. There are source codes, NDC, GPI, Multilex, Hripcsak, and so on. This is how the data get encoded in the sources. Sometimes they don't get encoded at all, and you just have little strings, like in EHR systems. If you have patient-reported drugs that they are on, then you just get strings, and there is nothing to code there. So the source, same situation with the condition. And then there are concepts. And there is a concept for drug product, and there are concepts for drug ingredients, and there are concepts for drug classes. And you're going to do the same thing as you do with the condition, and you're going to do it in the moment. Okay? And then there are relationships between these concepts, and there's ancestry. Here's a drug hierarchy. Looks in principle the same way as a disease hierarchy, except there are different vocabularies. OMOP as a standard concept, Rx norm. Rx norm is a drug terminology that's maintained by the National Library of Medicine down the road from here. And what they do is they take reports from, so the problem is there's no one authoritative source in the United States for all products that sell in a pharmacy. Okay, so I say it again, there is no one authoritative source. Nobody knows what's all available in the market. There used to be a system that was supposed to solve that problem called NDC, National Drug Codes, and the FDA tried that in the 80s to actually be this one central repository of things. And then there are all sorts of things which they don't regulate, or it's old stuff, or it's a needle to something that is a drug, and so they gave up somewhere in the late 80s. And the NDCs have their own life now, and nobody, you know, there's really not much you can do about. So what Rx norm does is it sources from all sorts of other people who collect NDCs and say, all right, give me all you have, and then they put it all in a big pot and stir it, and then they deduplicate it and make Rx norm out of it. And they're doing a phenomenally good job, given the fact that it's free or paid by the US government. It's an amazingly good quality. And so, and then you have the source codes down here, and they get mapped into Rx norm. NDCs get mapped into Rx norm. Okay. So it's the same situation with ICD-9 and SNOMED. Here's NDC and Rx norm. There's a little problem. OHDSI is an international thing, and there are people living outside the United States and having drugs and having data from outside the US. And outside the US, there's different drug markets, and there are different products. And actually, the overlap isn't that much on the product level. It's about half or less. So there are about as many drugs in England that you can get in the exact same way here as that you can't. So there's a whole lot of drugs which don't exist here. And Rx norm is a National Library of Medicine paid for by the US government, of course, doesn't give a damn about them. So here's the exception from the rule that OHDSI never invents new concepts. We add the international drug vocabularies in here into the Rx norm system, so it's like one common universe. So whether the drug is an Rx norm or Rx norm extension makes no difference, same relationship, same ancestry, same logic, same everything, except one is provided by the NLM, and the other one is provided by OHDSI. That's all. But since we are, most of us are, John.
Who?
What?
There's like a WHO drug dictionary. Is that in there?
So WHO drug dictionaries and ATC and all these things, they don't go to the level of a product. So a product is a combination of an ingredient or a combination, strength, form, and if you have brand name, if it's branded drug, and they don't have that level, that would be way beyond. But we do. So now you do. And so, you know, if you have an NDC, all NDCs are going to map into Rx norm because it's a US thing. But EU product or GemScript, this is the English thing, half of it goes to Rx norm, half of it goes to Rx norm extension. But you don't care. It doesn't matter. The queries work exactly the same way in either one. You just treat them as if they were one thing. We could have called them one thing, but then what do we do with the NLM? So same thing as in the disease world. Procedure drugs, Hripcsak. So these are drugs that you don't get in the pharmacy. You don't usually get in the pharmacy a chemotherapeutic drug. You usually don't get in the pharmacy a vaccine and then jam it yourself into the arm. So there are drugs administered by the providers. They usually are in Hripcsak and CPT4. We map them to Rx norm. Okay? So all drugs are drugs. They are no longer procedures, just because the P stands for procedure. Let's find Warfarin. We need to find Warfarin and dabigatran. And I think because the database you have doesn't have dabigatran because it's older, we use Clopidogrel, which is also a blood thinner. Well, it doesn't matter. The idea is the same. All right, let's find Warfarin by keyword. Select star from concept, where lower concept name equal to Warfarin. So we already, you know, try to get away of is it spelled with a capital W or not. And I always do lower to get out of this stupid spelling stuff. And then you got a lot, as usual. So what do? We look for the S. Here, ingredient, Rx norm, drug, Warfarin, 1310149. Okay. These other guys are from the others. This is a French. This is NDFRT. That's a classification. This is pharma prep. It doesn't have a C because the pharma preparations aren't used for classification because there's really nothing to classify there. LPD Australia, obviously Australia. Multilexis England, SNOMED, they have drugs too. We don't use SNOMED for the drugs because they're much less quality than RxNorm. But they're mapped. So if you have a SNOMED drug for some reason, you map it over. AMT is in Australia. SNOMED has actually substance and pharmabiological product because sometimes the substance is something that occurs naturally and then they have it twice. So Warfarin is one of them. NDFIT chemical structure is a classification. ATC fifth is a classification. MESH, it's also a vocabulary from the National Library of Medicine to index the papers, and that's the mesh code. So same thing as what we found with atrial fibrillation. We need this guy, SSS, has to be RxNorm or RxNorm extension.
So we are looking at the generic names, is that correct?
Well, because we looked for Warfarin. But if you look for the brand name, you can look for the brand name.
Okay.
Yeah.
And it would still be falling under the generic name?
No, it will give you a brand name, and then you would have to take the relationship table to go to the brand name.
Okay. Thank
So everything is concept and concept relationship based. Nothing does any sorts of assumptions or anything like this. You have to go step by step. Let's find Clopidogrel, not dabigatran, Clopidogrel. Let's say we have an NDC code, right? So like we had in the atrial fibrillation, we had a ICD-9 code. Now we have an NDC code. This one, it's BMS's Plavix 75 milligram capsule. Okay, that's what it is. But we want to find this thing. What do? Select star from concept where concept code. It's theirs. It's not ours. If it were ours, it would be an ID. It's theirs, so it's a concept code. Toss this NDC code in there, and you get the NDC concept. So all the NDCs we know of, and we don't know all, but we know a lot. We probably know more than most of the other sources because we kind of like our NLM, just take everything what we can find. And you got it. You got this guy. So it's an 11-digit NDC. There are also 9-digit NDCs. You can go into that detail if you want to, but let's assume this is what it is. And then we do the maps too, because this is not a standard concept. Have to map it to a standard concept. We do this. We say I see concept ID 1. Concept ID 1 is this NDC concept now. This is the code. This is the concept. This is our number. This is their number. And the relationship is maps 2. And here you go. We got this guy, and that's Clopidogrel 75 milligram capsule. What is it? Here it is. Clopidogrel 75 milligram oral tablet, not capsule. Why do I think it's capsule? Oh, because they call it capsule. So NDC calls it a capsule. RxNorm calls it an oral tablet because they, for some reason, have believed that that's what it is. Plavix is the brand name. So that's how RxNorm, they have a standardized way to create all these names. The names are always the same, right? NDC, you can get any name you want, with brand, without brand, abbreviated, whatever you want. And RxNorm always have very nicely standardized names. Ingredient, strength, form, brand name. If there's a brand name. And it's an S. It's a branded drug. Vocabulary is RxNorm. The domain is drug.
So if there's a generic brand or another brand name, are those in RxNorm or the concept ID?
So if there's the question is if there's another brand or the generic one, are there other concept IDs? Yes. If there is a brand that's not Plavix, right now it's still under patent, so it's Plavix. But as soon as it got out of patent, they invent their own brand names. Going to be different concept IDs. But hierarchically, yeah, we're going to get there in a second. So the problem is we have now Warfarin as an ingredient and Clopidogrel as a 75 milligram oral tablet. Okay? We want the ingredient because we want all patients, whether they take 75 milligram, 150 milligram, 500 milligram, 700 milligram, doesn't exist. We want any product that contains clopidogrel. Okay? We just want the ingredient, the active compound. What do? We take the ancestor table because ingredients are ancestors of the drug products. So what do? You hold the descendant and ask for the ancestor. Okay? And here you go. This is me, Plavix. This is me, the generic form, and it's still level of separation of 0 because actually it's the same level, right? One has a name, the other one doesn't have a brand name, but it's the same product, it's the same thing. From an analytical perspective, it's the same thing, okay? And then above that are what's called branded drug forms and clinical drug forms and branded drug components and clinical drug components. If you don't know, if you do an order, patient order, and you just say, put the patient on 75 milligram clopidogrel, you don't care whether it's a tablet, a syringe, anything, then you only have a combination of 2. It's not a full product. It's called drug component. You get strength and ingredient, but not form, not brand name. And in EHR, you have this routinely. In claims, you never have it, because you always have exactly the product that left the pharmacy. Okay? In OMOP, it doesn't matter. You can have both, because hierarchically, they're connected. And here's your ingredient. So again, look at the S's. Don't look at the C's. Look at the S, because there are classifications, the S. Here's the ingredient clopidogrel. So ingredient is an ancestor of drug forms and drug components, is an ancestor of drug products, or drugs.
If you had multiple doses or multiple strengths, they would fall under.
So the question is, what if you have multiple doses in the same product? It's impossible.
It was a 25 grams
Yeah.
versus a 75 grams.
Oh yeah, we'll go there. Yeah, what if you have several doses? We'll get there. I'm not going to give the answer, so I don't have to repeat the question. This is the one, clopidogrel as an ingredient. RxNorm has the ingredients. If you can't find an ingredient in RxNorm, it's probably your problem and not RxNorm's problem. They curate this stuff really well. Okay. The only thing that they kicked out a couple of years are homeopathic products. So if any of us wants to do that kind of research, then we have to talk. They're still in there, but they're all deprecated. Now let's check out the ingredients. So you hold the ancestor as an ingredient, and you ask what are the children, and then you get all the products with all the different forms, with all the different strengths, everything there is on the market. Hold the ancestor, ask for the descendants. Here you go. This is me, Warfarin. Then you get the drug components and the drug forms. And the groups, but they are classifications, which we cut off. And then you get the products. Okay? So you have solutions, tablets, injectable solutions, which is sterilized. This is to drink, it's not sterile. And as you can see, in the US, which is RxNorm, you only have the dry stuff. No, you now do have the other one. It changed. Okay. So now you have everything. No, actually, it's Warfarin. It's in the cloud. Okay, I'm mixing things up. Forget what I just said. So RxNorm is the stuff that is on the US market. RxNorm extension is the stuff that's outside the US market. Which one you can find out by looking which country-specific code is mapped to that thing. And then you know, oh, it exists in France and it exists in England. But from here, you know it doesn't exist in the US, but it really doesn't matter. You can see, look, they're completely, logically, they're completely identical. So outside the US, you have 0.02 milligram per milliliter, and in the US, a little bit too close here, 0.6 milligram per milliliter solution. why you have one in one and not in the other, you have to ask the pharmaceutical industry and the regulators of why they think that's a good idea. All you have to do is, if you now want to ask the same thing, what products are on the market for clopidogrel? By the way, it goes way down here, right? This is tens and hundreds. What drugs contain clopidogrel? Same thing. All you do is, instead of asking for this ingredient, you ask for that ingredient, and it works the same way. So this is me. Here are the forms and the components, and here are our products. Okay. And here the situation is that clopidogrel you get in the US only in dry form, and outside the US you get the solutions and the injectable stuff. No good reasons. You know, you get Nicorette, you get in the US as a chewing gum and as a patch, and outside the Nicorette, you know, to stop smoking, you get it as inhalers and all sorts of other. With it's the same brand, everything, but they don't sell that here. So this is really it. So the hierarchy. So essentially, the hierarchy tells you all the products that exist for an ingredient. That's pretty much a take-home message here. And the other way around, you can go from a product and find out all the ingredients. If a product has more than one ingredient, because it's a combination product, then it will have two parents or two ancestors. Otherwise, it works exactly the same thing. You know, the worst contenders are these vitamin preparations, like Centrum or so. They have like 30 parents or ancestors, I should say, because they have like every vitamin that exists in there, and so you get 30. Right? In the US, it's about half-half. Half of the products are combination products, and the other half are single ingredient products. Outside the US, where's Dima? Is there more or less? I forgot. Where is he? He's gone. Dima, outside the US, there are more or less combination products. More? Okay. Outside the US, they're like the combination products more. But here it's about half-half. But most of the combination products are over-the-counter cough syrups. So the drugs that we are all working with here, and our friends from the FDA, is mostly the single ingredient drugs, but not all. You can get combinations from time to time. So if you can go back further up in the hierarchy, and so above the ingredients are the drug classes. And there's a drug class called ATC, antithrombotic agent, which means essentially anticoagulant or blood thinner. That's what that is. So that drug class knows all the ingredients which are anticoagulants. And since it's the ancestor table, it goes all the way down, all the way the generations, it also knows all the products. So this query limits it to the ingredients. If you take this clause away, it's going to give you all products that thin blood in one query. Okay. No more Wikipedia and then NDC collecting from red books and all this nonsense. It's a complete waste of time. If we run this, this is a good list. If you pick up Wikipedia, you get pretty much that list. Right? Here's our Warfarin, heparin. Here's the Clopidogrel. Rivaroxaban, it's a competition of dabigatran. Where's dabigatran? I think it's here. Can't see it. I have to pull it down a little. And again, if you want to get the descendants of those, which are the drug products, you remove the limitation to ingredient in the concept class ID. Okay. Any questions so far? Exercises. Let's find metformin, all ingredients, right? Tolazamide, telmisartan, whatever you want. 50 minutes. So same thing, find it by name, find a product. If you know the brand name, use the brand name. Oh, use the brand name. No, actually, it's this. You can still hear that. Same thing as with the atrial fibrillation and gastrointestinal bleeding. Use the hierarchy, use the mapping in the concept relationship table. So remember, we need ingredients in the concept class, and we need domain ID drug. Sometimes drug names show up as lab tests, but then it's a measurement or an observation. Because they do things like checking warfarin and concentration in the blood. It doesn't mean you actually get the drug administered. Pressing on. So I think everybody knows what, oh, I'm sorry, I have to go away from the camera. Next exercise. It's always when the class gets loud and they've done and they're going into all sorts of other. These are the numbers. Yes? No? Now we have to get ratchet up one level of complexity. Find the standard drugs, or standard concept IDs, for these guys. They are codes. They're actually ATC codes. Oh yeah, this is not an ATC code. Yeah, okay. So they're codes of some kind, and you need to be able to either map them or navigate the hierarchy to the standard drug concept.
So they're drug codes. That's what we'll tell you.
Drug codes. And one of them, at least one of them is ATC, as you know heard. So.